Hello, I'm Stuart McCarthy and I'm with CANARIE, and today I'm talking with John Spence of the Health Services Virtual Organization. John, could you please briefly explain to me what is the Health Services Virtual Organization?
Well, the Health Service Virtual Organization is a group of universities and government research labs that have come together to put together a platform to support medical teaching and learning, both for medical students, but hopefully in the future for medical practitioners, lifelong learning.
So where are these facilities located?
Well, the facilities are located across the country and in the United States, and actually we have one location in Europe. In Canada, we have McGill University, and of course the lead, Northern Ontario School of Medicine, is the lead, and Rachel Elway is the PI, and she's resident there. And also we connected to Stanford University in Innovation Learning in the States. Okay, they were partners as well. And also, as participants, we connected to Cork University in Cork, Ireland as well, and also the University of Ottawa medical faculty here as well as participants. So they weren't really part of the contractual part of the program, but they definitely became very enthusiastic users of the platform.
Great. And a lot of connections. How is it being used today?
Well, it's being used today. Basically, what we're running now is we're at the stage now where the platform's developed, and we run a series of activities called Sim Challenge, where we challenge students at the universities to come together and try to solve complex medical cases. And when they do, they dial onto the platform, and then they can access medical simulators that exist at the various locations. And these simulators actually can talk to one another and actually send information one to the other. And what the clinicians do, or their teachers do, is they design complex scenarios for them to solve. And so far, we've got an enthusiastic response from the students. They like the social contact and also collaborating with students in other locations to solve complex problems as part of their learning.
Excellent. And what do you think is the most important piece of work that's been done on it today?
I think the most important work that's been done is actually to use cyber infrastructure or CANARIE Network actually to provide the bandwidth, to provide the high level resolution, and also to connect these simulators in a very organized fashion, because what it does is actually share these technical devices for more learners. So from a technical standpoint and coordinate, I think that's the most important part. On a social part, I think it's actually bringing researchers together to continue to develop medical simulation and also to have actually users actually use what we build.
Is there, because of this, I guess, this critical mass of simulation that's being created by this, are there things that students and researchers can do that they otherwise wouldn't be able to do?
Yeah, there's basically medical learning is very visual. And I'll just highlight we just did a demo 2 days ago where we highlighted one of the edge devices or simulators, and that was the camera array. And basically what the camera array allowed a student at a distant location actually control their field of vision of surgery or a demonstration of a technique that's being done from any angle and zoom in, etc. And so what that did was really provide increased observation. Either if you're in the room, if you did the same thing, or because field of vision sometimes can restrict it. And so the students and clinicians that saw this in action thought this was really an increasing the value of learning in that environment.
So how does this ultimately benefit Canadians?
Well, I think what it really benefits, one of the key, health is a huge problem in Canada in terms of health services, and one of the key things that the medical faculty wants to do is actually increase their performance and eliminate mistakes. So what this simulation does is allow people, like they do with pilots, you have to spend so much time on simulation before they operate on you. So one of the key things is actually to increase performance of healthcare services, but more importantly to provide more on realistic simulation training for health practitioners and therefore enhance the services that we receive as a result of that.
Actually, now today, and you mentioned aviation.
Yes.
Simulation is getting so real and so advanced that the use of simulators is actually accelerating the deployment of pilots, for instance.
Well, that's exactly.
And
yes.
They don't need so much practical training.
Right. Well, we have issues in terms of a lot of immigrant doctors that come in, but they may not meet the same standards. So we'll use this simulation software not only to train new physicians, but also for physicians to continue to master their skills. Many, for example, my family doctor, I asked him how many heart attacks have you had in your 30 years happen in your office? Not often, but they can go and practice and keep their skills up to date as well.
Where does this go next?
Basically, what we're thinking, we now have, in the duration of the project, we have the technical platform that's been developed and debugged to a point where everything is working. And we've just started the user community in terms of sim challenges. So where it goes next is actually to see if we can now incorporate this platform into regular learning environments within medical faculties, okay, in Canada and maybe other parts of the world. And after that, once we have a user base, then take a look at is there potential to take it commercially, you know? So we want to, before we do our pitch for commercial, we want to have proof of concept and actually have a user base with which to go forward with to see if there's some commercial options that we can pursue.